My name is Anita Jean or Anita Jean. I'm Francophone. I am with the NorWest Community Health Centers. We're based out of Thunder Bay, but we have 4 offices around the region. And I'm the manager of community digital health equity. I'm trying to develop content for programs for specifically for seniors online. And Age-Friendy Thunder Bay is a group of organizations, and we're working together to improve the lives of seniors in Thunder Bay. So this is the health center where I am working from. This is in Thunder Bay. And so we're one of 100 health centers, community health centers in the province. And we have 2 sites that are east and north of us, about 3 hours away. And we have another site 40 minutes away west of us. And what we do is we have physicians, nurses, nurse practitioners, foot care nurses. We have therapists, midwives. We have counselors. We have system navigators. We do a lot of harm reduction. So everything is under one roof. And this is the information I'm talking to you about today, the right conversation at the right time. So this is a project, National Health Services Organization in the UK, in England. And so this Altogether Better program is specifically a tool to help you get the most out of your appointment. So it was developed by physicians and nurses. Altogether Better is involved in what we call community collaborative practice. What is collaborative practice? So it is when you work with your clients so that the client has got a more active role in their healthcare or in the services that you're providing. So a lot of tools have been developed, and we had several community health centers in the province of Ontario involved in a project where we did collaborative practice in 2018. And we did things like social prescribing. So your physician is prescribing you exercise or healthy food, not so much a prescription for medication. So we discovered this material back in 2018, and I loved it. And I've even tried it myself. So I'm going to use some examples as we're walking through this tool. So this is about helping patients and doctors have a better conversation. So there's a certain etiquette that happens during an appointment. You're coming there, you usually have a health issue, you want to have things addressed, and the physician or nurse practitioner or healthcare provider has their own way of approaching a problem. So how do you make sure that that conversation goes well and that you get what you want out of the appointment? And typically an appointment is, very focused, 10 minutes. When we go to community health centers, what happens is everybody is on salary. So you're not billing OHIP and you're not just coming in for a reason. We might be having longer appointments with our clients. But typically anywhere else where there's a billing to the health organization funding the entity or the physician, what you do is you bill. So you have a conversation and it's about one issue and it's over 10 minutes. Essentially, what happens is doctors and nurses follow a process when they're seeing someone. They listen to what the problem is and what you might want, what is going on, trying to figure that, and then solving the issue that you essentially expressing. So it is very focused, and this is how they work things out, except that maybe you don't know the dialogue or the process to make that most efficient, a most meaningful conversation. And the thing is, patients have got a role to play. So what you're doing is trying to have that interaction so that we consider how the doctors are trained or how the nurses are trained and how they approach problems and health issues, and help you essentially develop the etiquette so that you're going to have the most effective interaction. It helps patients understand what the doctor, it's usually doctors, but it could be a nurse practitioner, the process they follow. It also helps you get what you want out of the appointment. Most appointments go very well. They're straightforward. You get what you need. You understand what needs to happen. Some appointments don't go as well. You might forget something. One of your symptoms, you might leave the appointment feeling like it didn't go like you wanted it to happen. You wanted a prescription, you didn't get the prescription. You're worried the doctor's missed something. I remember how one time after I had broken my wrist, and I was writing things down. I had a little note. Was writing things down during the appointment. I did not take that sheet out of my purse. And of course, I did forget something because it's very focused when you're having the interaction and you might not recall everything. And even if I work in healthcare, I'm an administrator in a health setting, I get nervous for my appointment. I'm hoping I'm going to get certain things out of it. And even myself, I will get a little bit nervous and not be able to express myself really well. So I can imagine if you have a lot of issues going on, if you might be in pain, if you're not at your best, how things might not go so well. And some of the appointment, it might be very obvious that the questions are so simple, but it helps you organize your thought. So the appointment guide walks you through a process. You're going to think a little differently about your appointment. Things might surprise you. So it could be good for you to actually try it as opposed to just, oh no, this is another form. I don't want to do that. So give it a try for the next appointment. You can do this. You can show up with the guide at the appointment, or you can just write the questions on a little piece of paper and you have a smaller note with you. Whatever might work. So try different ways. And the doctors or nurses will not be annoyed with you if you're using a guide, or even a little list, or even a little checklist. It will show them that you are prepared and you're wanting to make the most of your time together. So doctors and nurses were involved in the development of this tool back in England, and it was researched and tested out to make sure that it is efficient. It was a few years ago, I have to admit, but to me, I think the questions are still relevant. We're actually going to be walking through this. So how to get the most of your appointment. This is how the document starts. If you think about what you want to say, it will help you get more from your appointment. It's like I have notes that I'm following for this presentation. I'm not reading the notes to you, but they help me because things are organized. This is the same principle, okay? It might seem simple, but it will increase the chances of the appointment going well. The first step to say why you have come to the appointment. What has led you to come to the appointment? Write that down. Let's use my personal example. So back in December, within a month, I had 2 different distinct colds. And what happened from that is I got a really bad earache. I had an ear infection and I could feel it down my neck. So I was too sick, I waited too long, and I was not able to get into an appointment for my doctor. So, and then I had some issues after the earache, leading from the earache. So I had eczema and things, and it was itchy even after the antibiotics for 10 days that I could get. I was still having some issues. So what is it that I came to the appointment? Was it because I had an ear infection, or because there's still something wrong with my ears? And we start with that point. So what is wrong with my ears? I have one that's still very itchy. I'm also concerned that I might not be able to go scuba diving because I do that. So I wrote that down. I'm concerned about my ears because things are not well. Second step. What do you expect or want from your appointment? You want a diagnosis, a prescription, reassurance that you're going to have a referral or something else. Well, for me, it was the itchiness was still concerning. So I had close to my ear and a little bit inside, and I never had eczema inside my ear. And the other thing is very much concerned about being able to dive again. I mentioned to the doctor, I had actually brought the little bottle that I had gotten for a trip years and years ago by a travel doctor. So I said, I would like to have on file a prescription for this medication. So that if I go diving, I'm not going to have itchy ear or an ear infection. So I was very clear. I wanted to have a prescription, and I was also concerned about the itchiness. And I wanted to, see if there's any concerns about me going scuba diving. So right there, three things that I wanted to assure myself of that if I had not prepared or I might have missed something. So the doctor was really clear on what I wanted. And you have to admit, for example, if I would show up and say, I want a prescription for pain, it doesn't mean that you're going to get one. In Canada, for example, there are some strict guidelines about physicians issuing narcotics or certain things like that. So it doesn't mean that if you ask for it, you will get it, but you might be saying, I'm very concerned about the pain, or I would like to have something where, I can manage at home or something like that. So be prepared and essentially have things written down. That's a good idea. Third step, and to me, what I would have done is I would have started talking about what I thought was going on, as opposed to I'm presenting with this. Why have I come? So I had to explain then that I had had the two colds, and it was I couldn't get in. Somebody else prescribed antibiotics. Things improved, but I still had issues with my ears. So then I give hints as to what I think is going on. Like, for example, never heard about eczema in the ear. But this is possible according to a nursing friend of mine. So it's important to have these things written out because this is part of the investigation that the physician or the nurse will essentially be asking you. So you're essentially giving them some ideas. Okay. During your appointment, you might want to write notes. For example, you're by yourself, you're not feeling well, or the physician or nurse practitioner or nurse has some suggestions, but you want to make sure that you remember that. Be very specific. You ask the question, but it's like, okay, so what am I supposed to do? What would you like me to do? And feel free to write it down. Okay. This is a way to record it. There's other ways to record it, but just be very specific that the physician or nurse practitioner understands how you are essentially recording that information. They may even write it out for you. Just being as specific as possible in terms of what it is that you want me to do. Anything in writing is good, okay? Or they may give you something written out for you to read. And finally, the fifth step, what is agreed upon? What is going to do if things don't go as expected? So for example, my ear infection, when I had the antibiotics, I was supposed to start that day. I was supposed to make sure I took the 10 days of antibiotics and not stop. And there were some side effects. I was asked, first of all, did I have any allergies to antibiotics? And it's like really be careful throughout that 10 days, but you need to really follow the instructions. And it could be, for example, if things get worse, this is at the point at which you need to go to the hospital, to an emergency department. So being very clear on what it is that is the plan that you have jointly agreed to. So essentially, it's very simple. It is 5 questions through your appointment where you will organize your thoughts, hopefully write them down because then you don't forget. If you are seen as having a plan with you, the place to get this tool is at altogetherbetter.org.uk under the resources.